Thank you for being here.
You're very welcome. All right. We're talking more about your rules for breakfast. Breakfast. That is my favorite. What about second breakfast?
I do like both, as long as they're both donuts.
Donuts. You know what's crazy is I don't even like donuts.
Yeah, it's true. I hate donuts.
Thank you, Jesse Eitzler. All right. So we are talking about your rules for best practice. And
best practice.
Specifically, we were
/
talking...
breakfast.
So important. The most fundamental meal of the day. We were talking about the blueprint rule. Or
yes.
what that means to you when we talk about blueprints. Give context here. When we're talking about blueprint, are we talking about like an architectural blueprint, or what are we talking about?
Yes, that's exactly what we're talking about. It's because I'm going into architecture.
Ah, dang it.
Yes.
I'm out of a job. Does anybody have anyone who's hiring?
So blueprint is really referring to our preoperative plan. When we have surgery, especially for a shoulder replacement surgery, we oftentimes we gather data, we get X-rays, we get CT scans, and then we're able to use those CT scans to make three-dimensional models that are virtual, and they can even make three-dimensional models that are 3D printed models. But you use that, and then that helps me to make decisions, and I can actually position inside of the program where we're going to place implants so that we can maximize tensioning, we can maximize range of motion, we can maximize the ability for patients to position their hand in space. But using that blueprint, we gather data, we plan ahead, we do the surgery before we actually do the surgery. And I think when you're attacking problems, that's an excellent approach as you move forward to try to plan ahead and be ready, because going in blind and just trying to figure it out as you go along is never going to be quite as productive as having a blueprint.
Well, I think it's interesting too. So, insurance companies hate covering anything, but we rarely get rejected on preoperative planning imaging, right? When we submit for a blueprint CT scan for our reverse total shoulder arthroplasty patients, we most of the time get those approved. I don't have to do peer-to-peers or argue about that, because the insurance companies also seem to understand that the more knowledge we have going into the surgery, the more likely that surgery is going to be successful for that patient. And they're going to save money because on the back end, there's not as much post-operative imaging, post-operative explantation and revision surgery and all of these things that can happen that actually end up complicating it.
Absolutely.
So
100%.
Follow the money, man.
Plan ahead, follow the blueprint, and life gets a lot easier.